Hey guys, it's Hina Chef here at Rebalance Physical Therapy in Center City, Philadelphia, as well as on the main lines in Narberth, Pennsylvania. And today I want to talk to any of you who might be dealing with a bladder condition called interstitial cystitis, or better known as painful bladder syndrome in its most recent changes in the name. So first of all, what is interstitial cystitis or painful bladder syndrome? So interstitial cystitis is a condition where it's usually a combination of symptoms that somebody might be feeling. So it's usually bladder frequency, bladder pain, and bladder urgency that somebody might be kind of presenting with. And sometimes it can be accompanied by a truly inflamed bladder or not at all. And for many people, it can be affected by certain foods that you eat, certain triggers from stress, and for some people, it doesn't do that at all. So basically, why are some people diagnosed with interstitial cystitis, and why are some people diagnosed with painful bladder syndrome? So basically, a long time ago, interstitial cystitis, a physician or a urologist typically, or you're a gynecologist that specializes in the bladder, would go in and they would do what's called a cystoscopy, and they would look at the bladder and they would see that there were all these changes or ulcerations within the bladder called Hunter's lesions, and there's other types of lesions that can happen. And basically they were saying, hey, if you had that going on and it was accompanied by these symptoms, then you were diagnosed with interstitial cystitis. However, what they have come to find is there are a lot of people that are still having these symptoms, but hey, they go in and they have a cystoscopy and they basically don't have any of these ulcerations going on, but they still have these symptoms. So more recently, the association has changed the name to be more consistent with painful bladder syndrome. And that's kind of how, some people might be diagnosed with interstitial cystitis. And I know this, at least in Philadelphia, there's certain physicians that say you do have that if we actually see the ulcers, and other people say it doesn't really matter. So basically, if you have interstitial cystitis or painful bladder syndrome, again, your urologist may be doing lots of different, medications to kind of help control, symptoms, as well as calm the irritation in the bladder down, and something called instillations as well. And sometimes, you can even go a step further and they might be using certain types of stimulation devices for that. However, in conjunction with all of these things, physical therapy, back in 2008, there was an NIH study, which I can say I was thankfully a part of, where we actually did a worldwide study that showed physical therapy intervention through treating fascia, as well as the pelvic floor and all the other musculature, as well as the pelvic joints and the low back, actually can have a profound improvement on the symptoms of painful bladder syndrome or interstitial cystitis. So I'm here to talk to you today about what that is and what can be done. So basically, if you have irritation of the bladder and it's causing you frequency, urgency, and pain, the way physical therapy can actually help is that basically if you've had this inflammation going on for a long period of time, okay, there was a study done way back in 1997 where they basically showed, they did an experiment with a bunch of female rats that you can see in this photo right here, okay? And they basically injected their uterus with Evans blue dye and mustard oil. And what they did is they wanted to create a chronic inflammation in one of the organs within the abdominal cavity. So the uterus, that's what they chose. And what happened is they went in and they saw that, okay, the mustard oil is not causing any inflammation anymore. But where's the blue dye? Like, where did it go to? Well, they found, to their surprise, that it wasn't actually in the uterus anymore, but it had actually moved into the muscular and fascial tissues of these female rats, in their abdomen, in their thighs, in their tails, in their, in and around their pelvic area, as you can see on this photo right here. And so what that kind of triggered this study back in 2008 is that, hey, if these patients are potentially having something similar going on, but we're going in and we're not seeing anything in the bladder going on, then could it be that the fascia and the muscles of these patients are being affected, and could that be creating some of the symptoms that appear that they're coming from the bladder is coming from? And so that's what this 2008 NIH study kind of proved to show. If we change the myofascia and the muscles of the human body, will that change the symptoms of these patients? And I am happy to say that we were able to prove that it did. And it was something like, 56% of the patients that were in this particular physical therapy pelvic floor myofascial group actually improved compared to its control by a significant amount. So that's basically what physical therapy can do for someone that has interstitial cystitis, or what the treatment is you're actually treating the fascia and the musculature in and around the abdomen, the pelvis, the hip, inside on the pelvic floor of the human body, and that will actually change the symptoms of the bladder. So what's going on there? So what I want, and some of you guys may not be familiar with what fascia and trigger points and all that kind of stuff is, so I'm going to try to explain that right now. So basically, the fascia is basically all the stuff that combine, it basically keeps your body together. So what keeps your organs from crashing into each other? What keeps, things separated but yet flexible? And I'm going to talk about this real quick because I have another video that really goes into depth about what the myofascia is. But it's kind of like this web type structure that penetrates all throughout the body, and it can affect shoulder to knee. And it's kind of like this grapefruit if you think about it. It's kind of like all the stuff that kind of keeps everything separated, but it keeps it flexible as well. So in patients that have interstitial cystitis or painful bladder syndrome, that fascia can get restricted. Now, not only is the fascia affected, but the musculature can also be affected. And muscles can develop something called trigger points, or spasming within particular areas within the muscle. And what that does is that spasming can create not only local pain in that area where the muscle is, and remember, your whole body is covered with muscles, so you can develop trigger points in any of these muscles. But in patients with, again, interstitial cystitis or IC and painful bladder syndrome, they can develop them more likely in their thighs and their abdomen, again, inside the pelvic floor, which are muscles within the pelvis. And that can give you symptoms of painful bladder, frequency, and urgency, and be part of a bigger syndrome of musculoskeletal dysfunction. And so going in and treating and reducing the trigger points and improving the myofascia can actually improve the alignment of the pelvis and your spine and your hip. And it can also, through a bunch of different nerves and reflexes that I'm not going to get into on this video, it can calm the bladder down and improve the symptoms that you might be having. And this is what we see every single day in our clinic, is we see lots of patients significantly improving that have these symptoms when you treat them from a holistic basis in all of these areas, okay? So I hope that this, and again, this might be alone, or it can be in conjunction with all the other things that you might be doing with your urologist or your urogynecologist to help get your symptoms under control. So I hope this was a helpful video to any of you who might be dealing with interstitial cystitis or painful bladder syndrome. Again, sometimes these things don't come alone. They may come with a slew of other things like hip pain, pain with intercourse, and you might have low back issues. You might have endometriosis. You might have a lot of different diagnoses going on. But in the grand scheme of things, this is all sometimes part of one big picture that might have developed. And the good thing is that you can treat a lot of things together if you have the right practitioner to treat this. So Again, if you live in and around the Philadelphia area, it's a no-brainer. We treat this every day. We see improvements every day. Come and see us if you're still dealing with this issue. Come to our website. It's rebalancept.com. That's REBALANCEPT.com. We have lots of other videos, and I hope this was helpful to all of you, and have a wonderful day.